My name is Anica Sanoir and I'm a registered nurse and a Caribbean certified diabetes educator. Today, topic is macrovascular disease in diabetes. Diabetes is a common chronic and controllable disease. It's common because it affects every 1 in 13 persons. In Trinidad, every 4 out of 5 admissions to hospital is because of diabetes. And it is chronic because it's a lifelong condition. There is no cure for diabetes. And it's controllable because good management depends on you, the patient. What happens when we eat? When we eat, most of the food is turned into blood glucose or otherwise blood sugar, the body's main source of energy. Normal blood glucose control. In persons without diabetes, glucose stays in healthy range because insulin is released at the right times and the right amounts, and insulin helps glucose enter cells. In persons with diabetes, they have high blood glucose, otherwise called hyperglycemia. Hyper meaning high and glycemia meaning sugar. And reasons for buildup are too little insulin is made, cells can't use insulin well, and liver releases too much glucose. Hyperglycemia can cause long-term complications. Some chronic complications include blindness, kidney disease, nerve damage, amputation, and cardiovascular disease, which includes stroke, heart attack, and loss of circulation in arms and legs. The complications of diabetes can be divided into 2 categories: microvascular and macrovascular. In microvascular, there's damage to the small blood vessels, and this can cause blindness and kidney disease. It also affects nerve damage where we have neuropathy, and this can cause problems in the feet and hands, heart and circulation, stomach, bladder, and sex organs. In macrovascular, this is what we'll be looking at today, there's damage to large blood vessels, and this results in stroke, heart attack, and poor circulation. In macrovascular disease, the artery, as we can see here, this is a healthy artery, and the one below, over time, fatty deposits clog up the vessels, as we can see here in the yellow. Macrovascular disease is the major cause of morbidity and mortality in diabetes, and the underlying cause is atherosclerosis. What is atherosclerosis? Basically, this is a buildup of fatty products in the walls of the artery. This is what we all know as plaque. After a while, it grows big enough whereby it can actually break and form fragments. These fragments result in blood clots and can block blood supply to the heart, brain, and lungs. Characteristics of atherosclerosis in diabetes. It's more common, it affects young age group. There's no sex difference, so you cannot say it's more in males than females. It is more smokers and faster in progress. Coronary heart disease. Known risk factors: age, gender. It affects more males than females. Once you have a family history of any kind of coronary heart disease, high cholesterol levels, hypertension, otherwise known as high blood pressure, smoking, diabetes, and central obesity. This is what we know in Trinidad as having a big belly. Coronary heart disease and diabetes. Compared to people without diabetes, people with type 2 diabetes have the same risk of getting a heart attack. It's 2 to 3 times higher of heart failure, and sudden deaths can occur if it goes undiagnosed or untreated. Main risk factors for atherosclerosis: high cholesterol levels, smoking, high blood pressure, central obesity, and lack of physical activity. Hypertension or high blood pressure. Most people with diabetes will develop high blood pressure. Cardiovascular risk is 2 to 7 times higher in people with diabetes, and up to 75% of the risk may be attributable to high blood pressure. The International Diabetes Federation, the IDF, recommends persons with diabetes who also have hypertension to be less than 130/80. The main treatment for high blood pressure is taking a medication as prescribed. It's not always going on a feeling that your head is not hurting you, you're not getting any neck pains or back pains or shoulder pains. So you must take a medication as prescribed, obtaining a healthy weight, decrease salt intake. It's not that you do not need salt, it's not no salt, it's low salt. Stop smoking and certain medications. Heart failure and diabetes. It's 2 to 3 times more common in diabetics. Sometimes it goes unrecognized and untreated, and it's a progressive syndrome. Prevention of cerebral vascular disease. Medication. Antihypertensive medication for your high blood pressure, aspirins, and of course the statins to help with your cholesterol levels. Take steps to reduce risk factors for heart disease. High blood pressure, smoking, high blood glucose, high cholesterol, and physical inactivity. Peripheral vascular disease. This is where we're dealing with the loss of circulation to the limbs. The same way the plaque clogs up the arteries in our hearts, it clogs up the arteries in our lower limbs and upper limbs as well. This is where we get loss of circulation. It is 15 to 40 times more likely to have lower limb amputation because of peripheral vascular disease. And people over 70 years have a 70-time increased risk of amputation. Some symptoms of peripheral vascular disease. Not everyone will have the signs and symptoms, but the ones who do, they complain of intermittent claudication. And what is this? This is basically pain at the back of the calf due to lack of blood supply to the muscle. And usually you get this pain more when it is you're lying down, and it eases up when it is you sit upright, and also rest that pain. And for those who have no symptoms, it can be marked or mistaken for neuropathy. This is deals with nerve damage. Signs of vascular disease. It is advisable that you do a foot examination at least once a year, and this is where the doctors can actually examine your feet and pick up signs of vascular disease. Diminish or absent pulses, where they actually test the pulses to make sure everything, as we can see in the picture here. Coolness to the feet and toes. Sometimes you can get a blue tinge color, and this will also help the doctor in diagnosing vascular disease. Poor skin and nails. Sometimes you get damage to the nails as well, and absence of hair on feet and legs. How do you treat this? Again, quit smoking for those who smoke, walk through the pain, and if this doesn't help, then surgery. So in summary, macrovascular disease is a major cause of morbidity and mortality. Aggressive treatment needs to be taken in with your cholesterol as well as your blood pressure, and of course increase in physical activity. So in summary, adopt a healthy lifestyle. Keep blood glucose in target range. You do your fasting blood sugars, and the fasting blood sugars, the first test you do in the morning upon arising, as well as testing you 2 hours after a meal. Make healthy food choices. You're basically supposed to have at least 5 to 6 small meals a day, a balanced meal. So your breakfast, a mid-morning snack, your lunch, a mid-evening snack, and your dinner. And for those who tend to go low at night, we always advise on a bedtime snack. Get regular physical activity. It is recommended 30 minutes a day, 3 times for the week. And of course, get tested regularly, or what we call the ABCs of diabetes. A for A1C or HbA1c. This is a blood test that gives you the average of your blood sugar for the past 3 months, and you usually get the result as a form of a percentage, and rightfully it should be less than 6.5%. Blood pressure. Every time you visit the doctor, you should test your blood pressure, and it should be below 140/80. And of course, you test your cholesterol and triglycerides. And if you smoke, get help in quitting. Thank you.